in the medical literature, we refer to them as electronic nicotine delivery systems. And they're basically devices that take a solution that contains usually nicotine and vaporizes it so you can inhale it. You know, you see that fog or that smoke. Initially, they were kind of marketed, I think, in response to a lot of the, you can't smoke here sort of things, because they don't produce the same sort of smoke and odor that you see with traditional cigarettes. And then they began to kind of move, I think, into can help you get off smoking, it can help you quit, and then, somewhere along the lines, it's become sort of geared and advertised more towards the younger groups, teenagers and younger adults, as sort of a fashionable thing to do. So number one, it was legal for a period of time. Teens could go and buy these things. That's sort of changed, though you can never really regulate the internet. It's a situation where they could get away with something, compared to like cigarette smoking. I mean, everybody hears the stories about smoking in the boys' room and that kind of stuff, and this is sort of along that lines. And then finally, the makers of these devices have really kind of marketed towards that age group. There's a bunch of flavorings, and they're very fancy-looking devices, and so they know their target, audience, and they've kind of marketed towards that. It is important to understand that we haven't had a lot of time to sort of quantify these devices. But what we do know is that what is becoming clear is that it can be a device. The use of these devices can lead to cigarette smoking later on. You can become basically addicted to nicotine and then transition to cigarette smoking, and that's been shown. There are some concerns that some of the chemicals in there, especially when it's heated, could be harmful. There's maybe some short-term harms, and then long-term we don't really know. And then one thing that's becoming more and more clear is that some of these devices malfunction and they explode and they catch on fire, and they're pretty high-powered batteries in there, and so there's a trauma associated with the use of these products that people don't always appreciate. And there is some studies that suggest that it's part of an overall tobacco cessation kind of program. You can use these to get people off cigarettes. Cigarette smoking is probably the worst thing you can do to yourself. And so going from that to using an electronic device, it probably does improve your life. It probably is safer, but it doesn't mean it's necessarily safe. But I think before people rush to conclusions on that, it is important to understand that a lot of these studies are in very structured programs. They're monitored and things like that. I think what people kind of imagine is like, you figure the person who wants to quit smoking just goes down to the local vape shop, buys a electronic cigarette, and says, okay, now I'm done with regular cigarettes. I don't know that that's really been proven to be the case. It does appear that it can create nicotine addicts, because that's the primary, that's the drug that's being delivered when they use these devices. And at some point, some people make that transition from the newer form of nicotine, i.e. these electronic devices, to the traditional deliverer of nicotine, which was the cigarette. And then now you have people that may or may not have been cigarette smokers. There's a lot of moving parts when you talk about substance abuse and misuse and addiction and things like that. But it certainly does appear there is a risk that the kids exposed to these devices at early young ages will later on have a higher chance of being cigarette smokers. The current thinking is you have really two camps that have shown some evidence that, one, you can get people off cigarettes by using these devices and probably improve their health. But then there's the other camp that's showing that when teenagers are using these products, they're more likely to end up cigarette smokers. So what it really screams for is some form of regulation, because in the hands of a healthcare professional as part of a structured program, it probably can help some people get off cigarettes, which will help their health in the long term. At that same time, though, you don't want these all over the place, because you've got kids using them, getting into them, and then now you're creating a new generation of nicotine addicts, basically. I would advise them just to be aware that it's out there. Just like Alcohol is out there. You have to have that discussion with your children. This is the same kind of thing. It's out there. Kids are going to see it, be exposed to it, maybe know friends, who are using it, and you just have to have that discussion that it's not safe. It's not this benign thing. Nicotine's a powerful and addictive chemical, and that's what you're being exposed to. And you just have to arm them with the information they can make the right choices, because you're probably not going to be able to keep them from it. It's too widespread.